Hi everyone, today we talk about liver cirrhosis. Our seminar presented by me, Enass, Waleed, Hussein and my colleague Amina, Nashwan, Ghanem, supervised by Dr. Karam, Turath. We start the definitions of the liver cirrhosis. What is meaning the liver cirrhosis? Liver cirrhosis defined as diffuse process with fibrosis and nodular formation, resulting in significant disturbance of lobular architecture and hepatic circulation. It is the end stage of many liver disease of virus etiology. Now, what is the pathogenesis of the liver cirrhosis? When cells are injured or damaged and die off, usually the dead tissue that was previously full of the living cells becomes fibrotic, meaning it becomes thickness with His and His protein and forms scar tissue. So when your liver is constantly forced to process alcohol like an alcoholic liver disease or subject to a viral attack for a long time like HPV or anything else that causes of a long or chronic state of liver cells or hepatocyte destruction and inflammation, your liver can become seriously scarred and damaged to the point where it is no longer reversible, at which point it becomes fibrotic, and in the liver we call this process cirrhosis. Because it is usually irreversible, cirrhosis is often referred to as end-stage or late-stage liver damage. When your liver cells are injured, they start to come together and form what are called regeneration nodules. You can think of these as colonies of the living liver cells. Of these are one of the classic signs of cirrhosis, and our wave cirrhotic livers is more bumpy as opposite to a smooth healthy liver. Also, with cirrhotic liver tissue, you will see that in between these clumps of cells or nodules is fibrotic tissue and collagen. Here is a classic histology image of the cirrhotic tissue. These clumps of cells in the middle is the regeneration nodules, and these blue strands surrounding it are binds of proteins, forms the process of proteins. If we zoom out a bit and look at it with naked eye, we again see these nodules which have fibrotic protein binds in between. Alright, but how do these binds of fibrotic tissue form? Fibrosis is the process mediated by these special cells called satellite cells that sit between the sinusoid and hepatocyte, known as the parasinusoidal space. Here is a pretty basic layout of the basic functional unit of the liver. You have all got the portal vein in the hepatic artery that combines into the sinusoidal, which then goes into the central vein, and these are all lined with hepatocyte right along this through. You have also got a bile duct, and all these three constitute a portal trace. So the sinusoidal space with literally means around the sinusoidal space, and satellite cells are about here. And usually in the healthy tissue, these guys' main function is to store vitamin A, and are otherwise considered quiescent or sort of dormant when the hepatocytes are injured through the secrete paracrine factor that activate and sort of change the satellite cells. When activated, these satellite cells lose the vitamin A, proliferate, and start secreting transforming growth factor beta, which then causes them to produce collagen, which is the main ingredient in extracellular matrix fibrosis and then scar tissue. As this fibrotic tissue builds up, it starts to compress the central vein and sinusoid. It is true that in the healthy normal state, these satellite cells play key roles in the natural wounds healing process. But when your liver cells are constantly injured, the satellite cells are constantly activated, and so that constantly produces collagen and factors that lead to fibrosis. So, what are the symptoms of the liver cirrhosis? Early, some fibrosis, asymptomatic, non-specific, example, weight loss, weakness, fatigue. Extensive fibrosis like jaundice, pruritus, itching skin, ascites, hepatic encephalopathy, confusion, hepatic splenomegaly, and hepatic carcinoma. Causes of the liver cirrhosis. Number 1, extensive alcohol consumption. Number 2, prolonged viral attack, example hepatitis B and hepatitis C. Number 3, non-alcoholic fatty liver disease. Number 4, inherited disease such as Wilson disease. Also, the causes of the liver cirrhosis are multifactorial. These are some pathological characteristics. that are common to all cases of the liver cirrhosis, including degeneration and necrosis of the hepatocyte and replacement of the liver parenchyma by fibrotic tissue and regenerative nodules and loss of the liver function.
Hello, my name is Amina and we will talking about pathogenic features. First, let's start with how the cirrhotic liver appears to the naked eye. Cirrhosis is a diffuse process characterized by parenchymal nodules, usually evidence of regeneration surrounded by connective tissue, with hobnailed on the external surface and nodular on the cut surface. The cirrhotic liver is variable in size, is at first enlarged, but with progression of the disease it becomes smaller. Also, it's variable in shape. Its surface is irregular, and the consistency of it is firm, and the color is often yellow if associated with steatosis. Now let's get to know the three macroscopic types of cirrhosis depending on the size of nodules. Micronodular cirrhosis, or what it's called portal cirrhosis. It's small regenerating nodules up to or under 3 mm, separated by thick fibrous septa, as encountered in alcoholic cirrhosis and malnutritional cirrhosis. Here in picture A, we can see cross appearance of the liver showing micronodular cirrhosis. In B, we can see, as we mentioned, multiple parenchymal regeneration nodules, but here with septal inflammatory infiltrates. In C, we can see marked ductular reaction. And in D, we can see sinusoidal congestion with no parenchymal inflammatory activity. Type 2, macronodular cirrhosis, or what it's called post-necrotic cirrhosis. The nodules here is variable in size with normal histological appearance. The nodules here is larger than 3 mm and surrounded by fibrous septa of varying thickness. This is seen in post-hepatic cirrhosis. The last type, mixed pattern, consists of nodules of different size, and this results from regeneration in micronodular cirrhosis. However, that classification is not a precise indication of the etiology of cirrhosis. For example, alcoholic micronodular cirrhosis becomes macronodular during inactive disease, and hepatitis C cirrhosis often progresses from initial macronodular toward micronodular cirrhosis. After we learned about the three macroscopic types of cirrhosis depending on the size of nodule, also there are two uncommon variants of cirrhosis. Number 1, incomplete septal cirrhosis, often referred to regressed fibrosis. Its presence of very slender septa radiating from enlarged fields toward the center of lobule. More precisely, its thin fibrous septa extend from portal tracts into the parenchyma, but often don't connect with other portal tracts or hepatic venule. This type of cirrhosis produces only portal hypertension with no liver failure. The prognosis is very good if the portal hypertension is controlled. Number 2, post-necrotic cirrhosis is the fibrotic stage of severe acute hepatitis, and it results in misshapen liver with large regenerative regions of liver parenchyma, and these regions separated by very broad regions of parenchymal scar. Also, there is lesser regions of regenerative hepatocyte. Now, after we talking about pathogenic features, let's talk about how to diagnose a patient with cirrhosis. Cirrhosis can be diagnosed by radiology testing, such as computed tomography, CT scan, ultrasound, or magnetic resonance imaging, MRI, or via liver function test, or via needle biopsy of the liver. Liver biopsy can be carried out from percutaneous or transjugular route. Liver biopsy is still considered the gold standard diagnostic method to identify the typical features of. Finally, I hope that our simple seminar has been useful to you, and I would like to thank Dr. Karam for his assistance and supervising us in the seminar. And also, thank you for your listening.